Today we're going to discuss type 1 and type 2 diabetes. Both conditions are considered disorders of the pancreas, and here's why. The beta cells, which are located in the pancreas, release insulin. Insulin helps glucose to move from the blood into the cells, so the cells can use that glucose for energy for the body. Type 1 diabetes is considered an autoimmune disorder because the body mistakenly attacks those beta cells in the pancreas, which then means no insulin production. Glucose accumulates in the blood. With type 2 diabetes, there are two things that could be happening. The body isn't using the insulin like it should, which we call insulin resistance, or the pancreas is not making enough insulin to meet the body's needs. That causes a lot of glucose to stay in the blood. Some of the contributing factors for type 2 diabetes include family history of type 2 diabetes, obesity, a history of gestational diabetes, hypertension, a sedentary lifestyle, and race. African American, Native American, and Hispanics are increased risk for type 2 diabetes. Signs and symptoms to watch for in your nursing exam. 3 P's: polydipsia, polyuria, and polyphagia. You already know that poly means a lot, so we're talking about a lot of thirst, a lot of urination, and a lot of hunger. Slow wound healing, recurrent infections, fatigue and weakness, and sudden vision changes. With type 1 diabetes specifically, the patients may also show signs of nausea, vomiting, and abdominal pain, and sudden weight loss. Long-term complications of diabetes. Diabetes has the ability to affect the nerves in the body, so we call that neuropathy. The kidneys greatly, so we call that nephropathy. The eyes, so we call that retinopathy. Cardiovascular disease, infection, and slowed wound healing. It's your job as the nurse. Monitor the patient's blood sugar by checking those finger stick blood sugar levels. Give the medications as prescribed, including insulin. Monitoring the patient for any neuropathy, so if they complain about numbness and tingling. With neuropathy, make sure you're advising the patients to perform good feet care. Patients should inspect their feet daily, especially in between the toes, and should not go barefoot. They should cleanse their feet daily in warm soapy water, and when cutting their nails, they need to make sure they're cutting it straight across. Wear protective, comfortable shoes at all times. Monitoring for any signs of nephropathy, so you're looking at the creatinine and the eGFR. Retinopathy, if the patient starts to complain about vision changes that are of sudden onset. Lastly, of course, if your patient has an infection or some kind of wound, you have to consider that they're going to have some slowed wound healing, so making sure that you're monitoring that really closely. Join me in the next video as we talk about hypoglycemia, and make sure you share this with a nursing student who may need it. I hope it helps you understand things a little bit better. Have a good day. Bye-bye.